Hi everyone, Dr. Elisa Kaufman here with Dr. Janine Moore from Nashville, Tennessee. Very cool to meet you. We have Haley Buckner from Elevate. She's the professional relations manager who I know and trust, and we speak all the time. And Dr. Josephine Weber from the Bay Area of San Francisco, not just San Francisco. And the reason that we are here is we want to talk to Haley about Elevate products. We are huge fans. We're all geriatric dentists, and we use the Elevate products, and we're just going to talk to you about the products and why we love them. And I'm going to start with my favorite joke, which is the all-day spray. We all use that. Do you use that with your patients? It is for dry mouth. It tastes delicious, and I use it off-label, so don't tell anybody from Elevate I do this, but I use it for patients who swallow the toothpaste. I put it on the toothbrush, and they brush the teeth, and then they can swallow, and it's a gel, so it really helps remove some of the bacteria and plaque. She can't say anything, it's off-label, but it works. And for patients who don't brush at all, I squirt this on the mouth. I swear it acts as a barrier to bacteria so that the food isn't attracted to the teeth, and the bacteria are repelled, off-label. But on label, spray it in the mouth, 2 squirts for dry mouth, and guess what my favorite part of the joke is? Patients ask me, how often can you use this? And I have to say, really? Why do you think they named it all day? Because you can use it all day. And let's go to the next product that we absolutely love, and a lot of patients don't know about this. So for the dementia patient, the Alzheimer's patient who do not allow drilling and filling, we're going to let Dr. Moore, we just met. I love her. Dr. Moore, my brain, talk about the SDF, the Advantage product. Not Advantage.
Advantage Rest.
Advantage Arrest, I know. And I like to call it arrest because what does arrest mean? It arrests the decay. So why don't you talk to us about how you use this on your patients?
Well, yes, hi. It's a great product, especially when you're in situations where you can't drill and fill and where you don't want to drill and fill. So it's a good way to stop the decay from spreading, stop the patient from potentially feeling discomfort. It's an awesome tool that we have now that will help our geriatric patients. And in some areas where we can't actually drill because of aerosols or if we can't get into to see the patient, we can dental hygienists can place the silver diamine. So it's just an awesome tool that we can use, something else that will help our patients.
Right, I like to call it filling without drilling.
Yes.
And it's great because there are patients who absolutely will not let you do any work on them at all, and yet you know that you can get in there and stop it, arrest the decay at whatever phase they're at, as long as it's not into the nerve. Or else they would have pain. So we know they don't have pain. You don't see the nerve. You do not have to remove the decay.
That's right. That's so
At first when it was Haley who taught me this, and sorry you're not getting. You tell them what you told me when I told them I was scooping out the decay, which made me a little nervous.
Well, yes, that's one of the neat things about the Advantage Rest product. You just can apply it right to the active lesion, and it will arrest and remineralize that tooth surface over time. So as an off-label use of the Advantage Rest product.
Well, I'm telling you, I used to scoop it out, and I felt like very nervous. And now the beauty of it is, I like to include it in my first visit. So when we see patients the very first time, I go in there, I do an exam and a prophy and x-rays if you can get the x-rays, and I will include the silver diamine fluoride, the arrest treatment. I call it arrest because it's the only product I know of. I don't even know if they have competitors, but I call it arrest. And I go in there and I include it the first visit. So if you have 11 lesions or little bits of decay in the mouth, the first time I see you, I do this. And then I go back a second time to make it, to see if it's hard and to make sure that the process is completed, because it really needs 2 visits. And then every visit I include it with the visit, and I treat it again. So when you go in there, Dr. Weber, are you noticing that the decay is hard? You go in with the Explorer and actually test it?
we actually do. And after that, we use this product, which is fluoride, and which kind of remineralizes everything. And
What's that called?
It is called Floramax. And after the diamine fluoride, we put the fluoride on there. And the longer it sits in there, the better, because it helps to harden the surface there and remineralizes it.
So Haley, is this the same product, the one I use, the single dose pack?
Yes.
I'm afraid of getting it. Let me see if I can show you. But I use the same exact thing, but I actually, because I hate bringing anything extra like little sponges or wells, this is a one-shot deal, but it's the same exact product. Easy to use. Dr. Moore, have you ever tried their newest product, which I'm looking for on the table? Yep. Do you know about this product, Dr. Moore?
I do not.
So I like that they name their products things that I can never remember, like Just Right.
It's just right.
And here's why they call it Just Right, and I'm not joking. I'm guessing. So Just Right is a fluoride toothpaste for our patients who get a lot of decay, and they call it Just Right. Tell me if I'm right, because I'm guessing, because it's a metered dose. So it's just the right amount of toothpaste. Is that right?
Yes, it's just
So,
right.
and here's what I like about it as a dentist. If it's a 6 month, here's what I wanted to ask you, Haley. This is something I meant to ask you yesterday. Is it 2 times a day meter dose?
Yes, for your patients that are moderate to high caries risk, they can use that twice a day, and it's prescription strength fluoride toothpaste.
Well, you can't buy this on Amazon, people. So you have to get your dentist, like us, to come and give it to you. But twice a day metered for 6 months? Is that what you're... See, I didn't know the answer. Or is it once a day?
No, so it's twice a day, and if they use this tube morning and night, it will last them 6 months. So there's enough to last them through their typical recare visit.
So I am really excited. I just learned something, because I meant to ask you if 6 months was twice a day, because my patients ask me that and I say yes, and I'm just hoping I was telling the truth, because I tell them when you run out of toothpaste that you need to call us. So we absolutely love this company, and I'm going to tell you other reasons why. I know that when I have questions, I pick up the phone, they answer the phone. I mean, try to call one of the other distributors and ask them about their products. You have to call, they'll put you to another person. Everyone that answers the phone there knows the answers to the questions. So let's talk about our favorite products. Your favorite product again was the?
Resting all day. I like the all day, and of course, this one here that will arrest the cavity.
The fillings without drilling.
Yes.
And don't let anybody tell you they don't believe in that. They just don't know about it. So if you go to your dentist and you're watching this and you ask them for a filling without drilling, they're going to tell you, look, you do not have dementia. You need a real filling. And that is true. But this is for special care patients, like geriatric patients or children that just can't sit still. And in the old days, they would take kids that had these big, huge problems into the OR. Now we can actually arrest it if we find it soon enough. So bring your kids to the dentist and continue to have oral care into your 100th year birthday. I just saw 100. Let's tell a favorite story. Do you have a favorite story about a very old patient who still cares about their teeth? Tell us.
My next door neighbor, she's 101, and she lives on her own, but she has it all here still. So I'm so happy that she still comes in, even though she only has a few teeth. I always say a few better than none.
Right. Well, you have a brick and mortar, so that's great. And how about you? What's your favorite story about an older patient that just makes you laugh?
Now we have patients that come to us from nursing facilities, nursing homes, and a lot of times the driver will just drop them off. So I love the stories that they tell. They're happy to be there, they're happy, and a lot of them just want to talk. So we like to entertain. We can't rush them. We have to give them that respect. So I just let them talk. And they enjoy coming to the dentist. A lot of people don't, but they do.
All right, I'm going to tell you my favorite. Every time I meet somebody who's over the age of, say, like 97 and they're active, even with dementia, I always like to ask them, what is your secret for living so long? And you know what I like to hear? I like to hear that they say they had a drink a day, because that's my biggest fear. So, all right, well, it was really great meeting you. And Dr. Weber's in our network, Geriatric House Called Dentistry, and you're joining very soon, very soon. And we'll have someone in Nashville. So if you're in Nashville, reach out to her right now. Tell her you want her to come to the homes. So nice talking to you, and thank you, Haley. You're always there for us, and we love you guys, and you have the best products, and I don't know about any other silver diamide fluoride, but Arrest. So out for now. Bye, everyone.
Bye.